Hello, my friends. I'm Dr. Anna Collins, and today I want to talk with you calmly and clearly about blood pressure as we grow older. Because many people live with it quietly every day, not realizing how much it can affect their comfort, their energy, and the way they move through life. I want you to imagine that we are sitting together in a quiet room with no rush, no alarms, and no pressure. This is simply a gentle conversation, the kind you might have during a longer visit where you finally feel heard. If you have ever checked your blood pressure and felt confused by the numbers, or if you have ever wondered why you feel tired, lightheaded, or unsteady, even though you were told your readings look good, you are not alone. Many people your age feel exactly this way, and it is very understandable. Blood pressure is one of those topics that sounds simple on the surface, just two numbers, but in real life it can feel anything but simple. For many years, people have heard the same message over and over again, that there is one perfect blood pressure number that everyone should reach. Many adults have been told that lower is always better, and that if your numbers are not low enough, something is wrong. Hearing that message again and again can create worry and sometimes even fear, especially when you are doing your best to take care of yourself. As a family doctor, I have sat with many patients who told me they were proud that their blood pressure was low, but quietly admitted that they no longer felt like themselves. Some felt tired all the time. Some felt dizzy when they stood up. Some felt less steady on their feet. Others noticed that they were not thinking as clearly as before, or that they avoided activities they once enjoyed because they did not feel safe moving around. Often they wondered if this was just aging, and many did not want to complain or seem ungrateful for their care. What I want you to know is that aging changes the body in gentle but important ways. And those changes mean that blood pressure needs are not exactly the same at every stage of life. This does not mean that blood pressure suddenly stops mattering as you get older. It simply means that the body may need a slightly different balance to feel comfortable, steady, and well supported. As we age, our blood vessels slowly become less flexible. This happens gradually, over many years, and it is a normal part of living. When blood vessels are younger and more elastic, they adjust quickly when you stand up, sit down, or move around. When they are stiffer, those adjustments can take a little longer. At the same time, the body's internal sensors that help regulate blood pressure may respond more slowly than they did earlier in life. This combination means that some older adults are more sensitive to drops in blood pressure, especially when changing positions. Many people notice this as a brief wave of lightheadedness when standing up, or a moment where they need to hold on to something to feel steady. Some people brush this off and say it is nothing. Others feel embarrassed to mention it. But these sensations are important signals from the body. They are ways your body is asking for support and balance, not signs of weakness or failure. Another gentle change that happens with age is the way the body handles medications. The liver and kidneys often work a little more slowly than they once did. This means that medicines can stay in the body longer and sometimes have a stronger effect. A dose that felt fine years ago may feel different now. This is not anyone's fault. It is simply part of how the body evolves over time. Daily life can be quietly affected when blood pressure is lower than what feels right for you. Some people stop going for walks because they worry about feeling dizzy. Some avoid stairs. Some wake up feeling tired even after a full night of sleep. Others find themselves sitting more during the day because standing feels uncomfortable. Over time, these small changes can add up, and people may feel less confident and less independent than they want to be. It is very important to say this gently and clearly. Feeling unsteady, tired, or foggy is not something you should simply accept without question. It does not mean you are doing something wrong. It may simply mean that your body is asking for a different balance. For many older adults, comfort and safety matter just as much as numbers on a screen. Being able to stand up without fear, to walk with confidence, to think clearly, and to enjoy daily routines is deeply important. Health is not just about preventing problems in the future. It is also about how you feel today and how you move through your day with ease and dignity. Many people ask why blood pressure goals might gently shift with age. One reason is that the immediate risks change. In younger adults, the main concern with higher blood pressure is damage that can happen slowly over many years. In older adults, the immediate risks of feeling faint, falling, or losing confidence in movement can sometimes have a bigger impact on daily life. A fall can change routines very quickly, and no one wants that. This is why many doctors now talk more about individual comfort and function when thinking about blood pressure in later years. What feels supportive for one person may not feel supportive for another. Two people of the same age can have very different bodies, different energy levels, and different needs. Some people feel their best with blood pressure that is a little higher than what they were told years ago. Others do well with lower numbers and have no symptoms at all. Both experiences can be valid. The key is listening to the body and paying attention to how you feel in your daily life. There are gentle habits that can help support steady blood pressure and comfort, especially as you get older. One of the simplest is taking your time with movements. Sitting at the edge of the bed for a moment before standing, or pausing briefly after standing up, can help the body adjust more smoothly. Many people find that this small habit makes a noticeable difference. Staying gently hydrated is another supportive practice. Drinking water regularly throughout the day helps maintain healthy circulation. You do not need to force large amounts at once. Small, steady sips often work best. Many older adults find it helpful to keep a glass of water nearby as a reminder. Eating regular meals can also support steadiness. Long gaps without food may contribute to feeling weak or lightheaded for some people. Balanced meals with a mix of protein, healthy fats, and gentle carbohydrates often help the body feel more stable. Movement is important, but it should feel safe and comfortable. Gentle walking, light stretching, or simple balance exercises can support circulation and confidence. The goal is not intensity. The goal is consistency and comfort. Many people find that even short, regular walks help them feel more grounded and steady over time. It is also helpful to notice patterns. Do you feel more lightheaded in the morning? Does it happen after taking certain medications? Does it improve when you sit or lie down? These observations can be very useful when you talk with your doctor, and they help paint a fuller picture of what your body is experiencing. One gentle way doctors sometimes assess blood pressure comfort is by looking at how it changes when you move from lying down to standing. If you feel symptoms during these changes, it is something worth mentioning. This is not about testing yourself or worrying. It is simply about understanding how your body responds. I want to pause here and say something very important. You should never change medications on your own, but you absolutely deserve to talk openly about how you feel. Your experience matters. Numbers alone do not tell the whole story. Your comfort, clarity, and safety are part of your health. Many people worry about speaking up because they do not want to seem difficult or ungrateful. Please remember that good healthcare is a partnership. Asking questions and sharing symptoms is part of caring for yourself. It is not complaining. It is being attentive. Some older adults feel relieved when they learn that blood pressure goals can be flexible and personalized. It helps them understand that feeling unwell is not something they have to accept in silence. Others feel reassured, knowing that they can focus on feeling steady and comfortable, not just chasing a number. It can also help to understand that blood pressure naturally changes throughout the day. It can be higher when you are active or stressed, and lower when you are resting. One reading does not define your health. Patterns over time and how you feel day to day are much more meaningful. There is also a connection between blood pressure and how clearly the brain feels supported. The brain needs steady blood flow to function well. When pressure is too low for someone's individual needs, it may contribute to feeling foggy or less focused. Many people are surprised to learn this because they assume lower is always better. In reality, balance is what matters. The kidneys also rely on steady blood flow. For some older adults, Very low blood pressure may feel uncomfortable and may not be supportive for kidney function. This is another reason why gentle balance and individual care are so important. As a doctor, one of the most meaningful moments is when a patient says they feel more like themselves again. Sometimes that comes from small adjustments, careful listening, and a shared understanding that comfort matters. Health is not only about living longer, it is about living well. If you have ever felt that your concerns were brushed aside or that your symptoms were blamed on age alone, I want you to know that your experience is valid. Aging brings changes, but it should not take away your right to feel heard and supported. You may find it helpful to keep a simple journal for a short time. Writing down your blood pressure readings if you check them, along with how you feel, can help you notice patterns. Even a few notes can make conversations with your doctor clearer and more productive. Many people feel empowered when they learn that they can talk about goals rather than fixed targets. A goal might be to feel steady when walking, to avoid dizziness, or to have enough energy for daily activities. These are meaningful goals, and they matter. If you are caring for someone older, this conversation is important for you too. Watching for subtle changes, like moving more slowly, holding onto furniture, or avoiding activities, can offer clues about how they are feeling. Gentle conversations can open the door to better support. I want to gently remind you that health information can feel overwhelming at times. You do not need to remember everything at once. Take what feels helpful and leave the rest. This is not about perfection. It is about understanding and compassion. As we come closer to the end of our time together today, I want to say this clearly and kindly. You are not a number. Your health is not defined by a single reading. Your comfort, safety, and quality of life matter deeply. If this conversation has helped you feel a little more understood or reassured, I invite you to gently support this video by liking it. That helps this calm, caring information reach others who may need it. If you would like ongoing guidance that is steady and supportive, you are welcome to subscribe to the channel. And if you know someone you care about who worries about blood pressure or feels unsteady, sharing this video with them may offer comfort. I also invite you to leave a comment if you feel comfortable. You can share what you have noticed in your own experience or simply say that you are learning. This is a safe and welcoming space, and many people find comfort in knowing they are not alone. Thank you for spending this quiet time with me. Take care of yourself gently, listen to your body, and remember that good health includes feeling steady, confident, and supported in your everyday life. I look forward to being with you again.